rubric out here to like keep me honest? Bless you. Okay, as long as somebody's got one person, just or a bunch of you, I don't care. Just pull up the rubric either online, on your phone, if you have it printed. I just want to make sure somebody's keeping me honest. If I forget something, I need to be told. Because it's a very complicated OSCE. Okay? Alright. Supplies that you need. An extra inner cannula, a suction catheter, a care tray, a bottle of water, the stabilizer. You'll sometimes hear this called trach ties because they used to actually be ties we tie. And some gloves, right? I'm gonna put these over here for right now. Okay. You have your patient. They're probably sitting up in a semi-Fowler's position. And a couple of things to remember is that you have to establish a communication system with them, whether it's thumbs up, thumbs down, blinking the eyes, anything. But that's a really key component in this. We are considering this patient to probably be a fresh tracheostomy, and so we want to make sure that they can communicate with us. Let me put this over your head, sweetheart. Okay. This is normally attached to a tubing. We are not asking you to do that. You don't have to. Although Linda does like you to have a ribbon. She does tell everybody to put a ribbon on the end of it. I'll debate that with her. I find that kind of, you don't have enough, we don't have enough flow meters on it, I think, on that picture for you to have both things hooked up. So let me think on that in a bit. So you're going to use a cup, right? At home, you're going to use something that's like either the top of a cooking spray cup, or the top of a hairspray cup, you know, that thing, that cap. The best ones are the ones that come off of the clothes washing detergent. You know, the little cup that you use to measure out the detergent. Those are actually the best cups to use. Okay, be on here. Okay, so your patient's gonna be all set up. You've got the cup on, you've got a gauze underneath here, and we're ready to rock and roll. Okay, all right. So you have all their supplies. We're gonna walk in. Knock, knock, knock. Hi, Mrs. Jones. How are you today? Great. My name's Renee. I am going to be your nurse today, and it's time to change your tracheostomy dressing and change your inner cannula today. I want to know, have you gone through that procedure before? Yes? Okay, well, even though you've gone through it before, let me just kind of go over with you what I'm going to do. So I'm going to bring in my supplies. We're going to get you all set up. I'm going to take the collar off. We're going to change out your inner cannula first, and then we're gonna, well, actually I lied to you. Sorry. We're gonna suction out your trach because you seem to be having some secretion. So first we'll hyperoxygenate you, which means I'll give you a little extra air via the bag. Then we're gonna suction out your trach. And if that's feeling good, then we'll move on to changing out that inner cannula. And then we'll go ahead and change your dressing and clean the site a little bit. And then we're gonna go ahead and change the stabilizer that's holding that trach plate in place. Okay? Do you have any questions about what we're gonna do today? No? Okay. The other thing I have to ask you is we need to establish a type of communication. I know right now you've just nodded for me, so you can keep nodding or shaking your head, or if it's easier for you to do thumbs up, thumbs down, we can do that. Okay, you've chosen thumbs up, thumbs down. Okay, so how are you doing then? Thumbs up? Awesome. Okay, before we do everything, there's a couple things I'm gonna do. First of all, let me just double check your identification. Now, identification could have been done when I first walked in, or we can do it now. But anyway, either way, you wanna do it before you do a procedure. Make sure you're doing it on the right patient. Real important, okay? Okay, so this says your name is Jean Jones and your date of birth is 5/10/63. Is that correct? Yep. Awesome. Thumbs up. Fabulous. Okay. So let me just check our emergency equipment here. So we have 2 trachs, one the same size that Mrs. Jones has and one a little smaller. Does anyone know why we want a smaller one?
Just in case it closes out.
Yeah. When it comes out, especially if it's a new trach, there might be some swelling that'll happen. You'll have better luck putting in a smaller one if that happens. It does happen. They cough them out. It does happen. Not often, but it does happen, so you want to be ready. You have an extra inner cannula. You have a working suction. and you wanna check your suction, so, or at least turn it on. So you're gonna turn it on, and I always go, okay, it's turned on, but I'm gonna check it again with the water. I have this turned up all the way. I've got my bag mask. We're gonna take this off. I personally like to go like this and make sure it's working. But I have a working suction, I have a working bag mask, and I have it hooked to 100% oxygen. Okay, so I have all the things I need for my emergency equipment. Okay, Mrs. Jones, I'm just gonna wash my hands. So here's where, you can show me the 20-minute or 20-second washing of the hands when you first walk in, or you can show it now, okay? Either one would be acceptable as long as the first time you wash your hands, you go the 20 seconds. So there was a argument about this, and I just want to bring it up so that we can be really clear about it. So the first time we have you wash the 20 seconds. So we can see your technique and make sure you know the 20 seconds. After that, we don't have you do that, right? We say you can say, I'm scrubbing my hands for 20 seconds and move through. And the reason why we do that is to decrease your time anxiety. You guys are still learning this process. A practice nurse, so like we give you 15 minutes to do your Foley, a practice nurse could probably put Foley in about 6 to 8 minutes. We give you 15. If I were to make you wash your hands as many times for those 20 seconds, your time anxiety would be through the roof. Now, when we had you scrub the site, we wanted to see you scrub it for 30 seconds on purpose because we need to see that you can do that procedure. It's very important. That prevents CLABSIs. So we need to see that. You can't just tell me that. That's an important component of that procedure. And if you don't clean that site good, you could set up an infection that can kill a patient because those tubes go almost right to the heart. Okay? So you don't want to be responsible for that. So one of the arguments that a student made was like, well, I could kill somebody if I'm not washing my hands for 20 seconds and you guys don't make us do it 20 seconds throughout the whole thing. And I said, true. So if you'd like, for consistency's sake, we'll make you guys all scrub your hands for 20 seconds all the way through if you want, but I can't change the time. That doesn't make any sense, right? It was an interesting argument, but the reality is that we're trying to decrease your time anxiety. If somebody feels that we're being inconsistent by doing it that way, please let me know. And if the whole group wants to go to washing your hands for 20 seconds for every time you wash your hands, we can do that. If you feel it's better for consistency, up to y'all. Think about that. Okay?
We just have to like scrub our hands, like, oh, washing hands, we don't have to verbalize 20 seconds.
You should.
Oh, we should.
You should.
Okay.
Yeah. Just to remind, so that we know that you're not gonna do this cursory like, okay? Good idea.
Okay.
Okay. Now, would you say all these things when you were working with a real patient? No. The reason why you have to tell us is because we need to know what you're thinking. Okay? So, realistically, there was at one point where we thought we should make you guys not say anything, and we were like, no, that doesn't make sense because I don't know what they're thinking. So, we need to find out what you guys are thinking. So, okay? All right. So, we've checked our emergency equipment. We made sure we have working suction, working oxygen. All that is all good. I'm going to put my gloves on, and I've washed my hands for 20 seconds. I'm just skipping through the 20 seconds right now, okay? Because we want to see, you guys want to see the down and dirty, okay? So I've scrubbed my hands for 20 seconds. I'm going to wipe down my table. And again, it's 30 seconds, so. And this, don't do this. Big swipes, okay? Big swipes. Get the whole table. Go like this, but count out loud your 30 seconds if that helps you to get the 30 seconds. I think some of you all had timers or something. I thought it was really smart. So that's great. I love it. That's great. Okay, so the 30 seconds, and then at the very end, end it with like the sides. Okay, but the 30 seconds, big swipes. Okay, be definitive about it because the wipes are desiccants, and it can't work. Does everybody know what a desiccant is?
Kills off anything.
It dries stuff out. A desiccant dries things out. So the chemicals are desiccants, but the only way that that's going to work is the bugs that are on the table if you put some pressure on them, you're gonna break their cell walls. And then the chemicals can get in and dry them up. And that's why you wait the 2-minute dry time, because it's gotta dry, and that's how it works. Okay, does that make sense? Okay. You are not creating a sterile table. People said that. This is not a sterile table. It is a very clean table, but it's not a sterile table, okay? It becomes a sterile table when you put a sterile drape down, okay? But that's not sterile, it's clean. You're cleaning the table, okay? I would take my gloves off, throw them away. Hygiene, okay. It's dried for 2 minutes. We're gonna go ahead and put our supplies down. Again, set yourself up for success. This is gonna be last, so it's farthest away from me, okay? I'm gonna do this, and this, and this, and this, okay? Actually, you know what I'm gonna do? I'm gonna do it like that. Okay, think about how you set it up. What are you gonna use first, second, third, fourth, right? The first thing I'm gonna do is I'm gonna change out my suction catheter, because I don't know how old that one is, and maybe my colleagues said they put a clean one up, but I didn't see it. So I wanna make sure it's clean. So I'm gonna change this out, okay? Now, you can wear gloves doing this, or you can do no-touch technique. It depends on what organization you work at. At Valley Med, you wear gloves for everything. So I'm gonna go ahead and simulate that. But if you work at El Camino, or you work at Kaiser, ooh, who's at Kaiser? Anybody? Nobody. Oh, good thing, because they're on strike and they might have kicked you guys out again. It's just it's not just, it's the SEIU groups. So that's like nursing assistants, medical assistants, really impacting clinics, but not so much inpatient. But Kaiser's really funny, they'll kick people out during strike. Well, we did too. Yeah, we did too. Although most of you all were done by then, by the time we had our strike. Okay, all right, so got gloves on. So I wanna change out that suction catheter. Okay, the sheath keeps this clean and sterile. And then we have this box. This box is sterile inside. And what we'll do is we're gonna put it there. Get rid of our packaging. I'm gonna change this out. Okay, so now we have nice clean. We have to see this in the OSCE that you change this out and make that clean. Okay, I'm gonna throw this one away. Okay, sorry, I should have a garbage can here, but that's all right. All right, so I've changed that out. I've set that up, again, remembering to just pop it on the sides. Don't put your fingers in here. Just pop it on the side, just like that, and you're good, okay? All right, now I'm gonna go ahead and use no-touch technique. Well, no, I got gloves on, so it's not no-touch technique. Well, wow, that is sealed down really good. Did you guys find that these were sealed down so well? Wow. Like, normally you have like a whole like edge to grab onto. I had to like basically peel that. Okay. Some people like to take that lid all the way off. I don't, it's too much work. So, when you're moving it, while you still have just clean gloves on, you're just gonna be like this, okay? Don't ever have to use sterile gloves in this procedure, isn't that great? Yeah. That doesn't mean you don't not use good aseptic technique, okay? That means I'm not gonna take these hands that just touched a bunch of supplies and go in here and play, okay? But what I am gonna do is I'm going to take that out, and I am going to go ahead and take this out. Now, in the rubric, did it have me changing gloves before I did this part? Anybody?
Check.
No.
Okay, cool. You guys notice that these sterile drapes, they have a shiny side and a matte side. What side do you think goes against the patient?
Matte side.
Shiny side.
Chinese?
Shiny side's the plastic coating that protects the patient. The matte side is the absorbent side. It's not a big deal to be going over this. This is just to provide a clean, almost sterile space in order if the inner cannula were to come out. Oh shoot, I don't want this here yet. Does the rubric say this should be here now before I do the hyperoxygenation and suctioning?
Doesn't state.
Let's put that back.
Awkward.
You can do it either way.
Yeah, it is telling you to drape the patient.
All right,
and
then let's drape the patient.
hyperoxygenation comes later.
Let's drape the patient.
Yeah, drape on patient.
Drape the patient. We're gonna be going over it a lot when hyperoxygenation and suctioning. So it can go either way. You're mostly thinking this as a barrier. If they cough and secretions come out and those kinds of things. It is a safe place for the inner cannula to fall onto because in general it is going to be pretty darn clean. But you could do it either way. You could wait and do this after the hyperoxygenation, but let's do it this way because that's the way it's called out in the rubric. Okay? All right. Now, before I do anything else, I'm gonna get this all set up. I'm gonna take my water, I'm gonna pour it here, I'm gonna come around, and I'm gonna pour it in this well here too, okay? The other thing I'm gonna do is I'm gonna open up my inner cannula and I'm gonna drop it in. Now, you can come from the side. You just don't wanna go like over all of this, right? That's not okay because you've gone over all this. Yes, this is not a sterile procedure, but you wanna stay as clean as possible. So, you wanna make sure you're not going over that, and you wanna make sure, and you could set this up differently. You could go like this and do it that way. Does that make sense? Think about it before you do it. It keeps you from going over everything, okay? Because it will be considered a break if you like are going all over the top of this, okay? So be careful about it. You're keeping it as clean as possible. All right, don't get wound up about there are trach ties in here and a little scrub brush. Don't get tweaked out about that, okay? So, I just threw, well, that's okay, it's fine. You could have, before you put the inner cannula in there, reached in and take the Q-tips and stuck them in the water, but we'll do it later. It would work either way, okay? All right, so we have everything set up that we need to have set up. I'm gonna go ahead and change my gloves at this point, wash my hands, and that's because I've just touched a bunch of supplies. So I want to be as clean as possible when I go work with my patient. That might not be the exact point where we have you washing your hands, but this is how, again, think about it, think about what makes sense. When in doubt, follow the rubric. Okay, so Mrs. Jones, we're all set up and ready to go. What I want to do is go ahead, I see your oxygen saturation's only around 93, 94, which is a little lower than your normal, and I can hear the secretions in your inner cannula. So I'm gonna go ahead and first of all, take a second to listen to your lungs. Now, could have listened to the lungs before I draped, but I can also listen to the lungs after I drape, which is listen here, listen here, listen here, listen here. Okay, sounds like you've got a lot of secretions, a lot of upper airway noise, so we're gonna go ahead and take care of that. I wanna first though hyperoxygenate you. How am I doing? Anybody watching the rubric? Am I doing okay? Okay, cool. So, we're gonna hyperoxygenate the patient. Why do we do this? Anybody know why we hyperoxygenate?
Because when you're suctioning, you're going to be depleting them of oxygen.
Yes. Yes. Sorry, I like to tell you why we do things instead of just say do it. Okay, so you're doing this because we are basically, once we take the collar off, we've deprived them of that oxygen, and when we're suctioning them, and that's why you only suction for 10 seconds, it's like asking one to hold their breath. So we're keeping them from their oxygen. So if we can hyperoxygenate, which is give them a lot of reserve, then when we go to suction them, they don't bottom out on us. Okay, does that make sense, y'all? Okay, so we're gonna go ahead and move the collar. You can either move it or unsnap it or whatever. When you take the cup off, you just put it somewhere where you can get to it, okay? All right. When you go to apply this, you always have to hold the faceplate. So even though that you guys are gonna be using a water bottle to simulate this, you need to still hold the faceplate. You always secure the faceplate, always. Okay? Do not do this like this. I see this. Okay? Do not do it like that. Do not do it like this. I see that too, where they leave it on their chest and then they just do it like that. Don't do that. It's on the side, okay? And make it so it's your dominant hand that's doing the squeezing, okay? So, you take 1 to 1.5 seconds, you wait 6 seconds, and you do it again. 6 seconds is a long time. 2 to 3 breaths. So if you only do 2, it's not counted against you. If you do 3, you do 3, okay? Whatever it takes to get the oxygen up. So, oh, Mrs. Jones, it looks like your oxygenation is up now. Your SAT says you're at 99%, so we're gonna go ahead and take this off. Again, securing the faceplate. Take that off. Okay, Mrs. Jones, so we're gonna get ready to do some suctioning here. Okay. A lot of different ways you can hold this. This is the way I do it. You can do it a lot of different ways. You only want to be out about 4 inches, okay? If it's out like this, it's gonna flop around and it's hard to control, so about 4 inches, okay? I go in with my hand like that. Some people go in like this. It's up to you guys, whatever you're comfortable with, okay? So,
Renee? So it says right here,
thank
section
you.
3.
See, you gotta call me on that. Great. So before I do that, we gotta check to make sure it's working, and also by putting it in the water, we're lubricating it a little bit. It's a little wet. Okay. Thank you. Thank you. Thank you. All right. And also, if you've been using this all day, it kind of clears out any dried up secretions that are in there. Okay. So about 4 inches. We want to go in, and I'm using this hand to push it in. Okay? Now, with your mannequins, you do have the capability of going pretty far, or with your task trainers, you have the capability of going pretty far. You should probably get about halfway in. The catheter should be in about halfway before you go, you're gonna simulate a cough or or whatever. And then what you're gonna do is you're gonna occlude this and pull it back. Boom, done, okay? Do not occlude this as you go in because you can cause trauma. You have, your thumb should be visibly off of the green part, okay? Visibly off until you're ready to suction, then you visibly cover this and pull back. So I use this hand to push in and pull back. Does that make sense? Okay. All right. Mrs. Jones, you sound so much better. How are you feeling? Thumbs up? Awesome. So if I were to go suction Mrs. Jones again, I would wait 30 seconds. And I might even hyperoxygenate her again before I have to go in, but I would definitely wait 30 seconds between suctioning attempts. And if she didn't tolerate the suctioning, I would hyperoxygenate her after the whole procedure. So you do need to mention that. What would you do if they bottomed out when you suctioned them? You give them more oxygen, okay? Conversely, if you could tell that they were still full of stuff, you might have to go back in, but you need to tell me you'd wait 30 seconds, okay? Okay, Mrs. Jones, so if you're feeling pretty good, I'm gonna go ahead and put your oxygen collar on right now while we get ready to change everything for you, okay? Awesome. All right, so we've done all of that. Now we're ready to go ahead and get everything changed out. So what I need to do is, does the rubric have us changing gloves before we do this part?
Procedure, perform hand hygiene for
Yes.
the inner cannula, yes.
Yes.
And for the previous part for respiratory support, it says reassess the patient's respiratory status, including respiratory rate, effort, and oxygen saturation.
Yes, you do not have to listen at that point. You just have to reassess them. They're gonna be on monitors. So it looks like you're breathing okay. Your oxygen saturation stayed up at 98%. You look like you're breathing easier, okay? Just state that out loud, okay? But you do not need to reassess the lungs until the end of the procedure, okay? You don't stop and do another assessment, okay? You can tell by their work of breathing that they've improved. And please, you say that. Your patient improved. They're doing better. Don't make your life harder and say, oh. Okay, so just say, oh, you're looking so much better and you look like you're breathing easier. How's that feel, Mrs. Jones? Yeah, yeah. Thumbs up. Okay, so I'm gonna clean my hands, put on some gloves, and we're gonna get ready to change your inner cannula. So that is why we have you put that back on, because look at how much time it's taken me, right? That keeps them from having their oxygen if you leave that off. So that's gonna be a place where you can lose points, is not putting the collar back on when you need to, okay? So think about it as a human being. Would you want to be without that oxygen source for this long? Probably not. Okay, all right, Mrs. Jones, we're gonna go ahead and get ready to change your inner cannula. So I'm gonna take the collar off, and we are gonna do that right now. So the collar, always securing the faceplate, pinching and pulling, okay? Garbage. When we reach in to grab this, the only parts we can touch are the wings and the top part. That's it. Everything else below that is what needs to stay sterile. Making sense? Okay. I'm gonna put it in. And when it gets to the little tube, you wanna open the wings up and click it. Okay? Make sure it's in place. Be very particular about that, because what's gonna, I'm sorry, normally I wouldn't take this long, but I want to emphasize at this point, because some people get all tweaked out, don't do it, and then their inner cannula goes in and out all on them, and then they start manhandling it. Take the time to clip it to that little tube that we gave you. Okay, that's your trach. All right, Mrs. Jones, that went really well. I'm gonna go ahead and take out your old dressing. Okay, and I'm gonna put your collar on for a second, and I'm gonna go ahead and get everything ready for cleaning your site. So now at this point, I'm gonna put my fingers in here, touch the ends here, okay? Move this out of the way. Perfect, I'm gonna just get rid of those. I'm gonna find out where my split gauze is. There it is. And I'm gonna keep one gauze out, because I want it to dry, and the rest of these things are gonna go in the water. Okay, at this point, this is a clean procedure, okay? All right, Mrs. Jones, we're gonna go ahead and clean the site. How am I doing on the rubric, y'all? Am I doing okay? Okay.
It says verbalized condition of the site.
As I clean it, I will.
Okay.
Thank you. So what I'm gonna do is I'm gonna take one Q-tip. I'm just gonna move this down a little bit so you can see better. I'm gonna swipe once underneath, okay? Garbage. Boom. I'm gonna swipe another time on the top. Swipe. The site looks good. I don't see any big drainage. I don't see any signs and symptoms of infection. Okay, now I'm gonna take a gauze, and I'm gonna clean. Might as well go under and over or top to bottom. I don't care which, just kind of get something in your, but you're gonna gently go underneath with this one. You're not gonna cram it up in there, because the Q-tips have gotten to the site. You're just gonna get this underneath part here. Got that one. Get this. We're gonna get underneath there, that one. Then we're gonna take this one, and we're gonna clean the faceplate. The faceplate collects a lot of yucky things. So we're just gonna clean the faceplate. Okay, we've done that. We're gonna take the dry gauze, dry off the faceplate, and dry off the skin around the trach. Don't go underneath and dry. I just want, because what happens is saline starts to drip down their neck. So, you know, dry that off, okay? Top and just barely on the sides here. Okay, so we've done that. Now we can put our split gauze in, okay? The split gauze. Okay, all right, our split gauze is in place, and now we're done, okay? Okay, Mrs. Jones, how'd that go for you? Thumbs up? Awesome. Okay, I'm gonna just clean up my supplies a little bit, and then I'm gonna get my friend to help me change the stabilizer, and then we're all done, okay? Throw everything in the garbage, everything's in the garbage, take my gloves off. Who wants to be my partner? Anybody? Come on, who wants to be on film? All right, come on over. All right, washing my hands. You get some gloves. I'm gonna have you on that side. We wash our hands, we put our gloves on. Okay, Mrs. Jones, we are back to change your stabilizer. Can you introduce yourself?
Hi, my name's Esther. I'm a nurse and I'll be working with Nurse Renee here.
Awesome. Thank you. All right, so Esther and I are going to do this stabilizer change. Okay. What's really going to be helpful is if you fold this over like that, so it doesn't stick on the old stabilizer. That'll help and gives you a little tab to push through. Okay. All right, so Mrs. Jones, we're gonna move your collar for a second, and then we're gonna go ahead and change this stabilizer for you. Okay, so I'm gonna go ahead and take that one apart. See how they catch things? So when I pull this out, I usually wanna fold that over like that. Okay, so what I'm gonna do is I will put this tab through, peel it, and apply it so it's secure. And now I'm going to send both bits through to the other side. Now, what you want to do is push down on the pillow and send it through. While you're doing that, you want to look to make sure it's not twisted, and you're kind of trying to look at the skin and you say, oh, the skin on your neck looks good. I don't see any redness or irritations or signs of infection. I'm going to move this out of your way a little bit. So now Esther's going to pull both bits through. I'm going to hold this down while Esther goes.
And then remove this one.
Remove that one. So while I was doing this, Esther would hold the faceplate. While she's doing her side, I'll hold the faceplate. Okay, you can get rid of that one. Just dump it in the garbage. Okay, and then go ahead and you can apply that one. Actually, leave the tab and stick it through with the tab.
So when you removed your side, Renee, Esther was supposed to be holding the
Yes,
down?
sorry, I missed that.
Okay, just double check.
I thought about it as I was like, oh shoot. All right, now we only need 2 fingers between the patient and this, so you might want to tighten that side up a little bit more, and I'll tighten up my side. There you go. And I'll tighten my side just a little bit more. Okay, so we should be able to, on either side, put 2 fingers in. So I can put 2 fingers in. Can you put 2 fingers in on your side, Esther? All the way. Just go like right in here. Perfect. Okay, so now it's not too tight. Now we go. So I apologize. I forgot to ask Esther to hold the faceplate while I removed my side. That was my mistake.
You want us to hold it like,
Just like that.
okay.
Is totally fine. Like, yeah, perfect. Okay. Done. Clean up your supplies. You're going to chart patients. Well, first of all, you're going to say, okay, Mrs. Jones, you're all done. How'd that go for you? Awesome. Thumbs up. I'm going to take this drape off. Take your old stabilizer. I'm going to throw this all away. I'm going to make sure the bed is down. I'm going to make sure she has her call light. So Mrs. Jones, here's your call light. If you have any issues or need any more suctioning or need anything else, please let us know. You did a great job. Thank you so much for your help. And then I'm going to leave the room. I'm going to talk about my documentation, which is going to be, keep me honest. My documentation is that, oh shoot, I got to do a set of vitals on her. I'm going to listen to her lungs one more time before I go. Sorry, forgot about that part. And I'm going to document the vital signs. Lung status, or what did I hear when I listened? Her oxygen saturation, say it's 98%, okay? Make it easy on yourself. Tolerated procedure well, and the site was clean, dry, and no signs and symptoms of infection. Am I missing anything in the documentation? Okay.
So I have to say the color amounts.
Oh, of suction, of what did I suction out? So her sputum was clear but thick white. Make it simple. Don't make it yellow or green, because now you got another issue you've just piled on top of yourself.
And respiratory assessment is basically like all the lungs is like clear now.
Lungs are clear, work of breathing. She has no increased work of breathing. And her saturation is 98%. So you listen to the lungs at the very beginning and at the very end. How did that feel?
You good?
So you said when you cleaned your area, throw away your supplies, then you have to check vital signs.
You can do it either way. You can check vital signs and then clean your area, as long as before you document you've cleaned your area. Either one would be acceptable. But don't clean your supplies and forget to change your gloves before you assess your patient, because you really should not use dirty gloves on a patient, right? Because once you touch all the supplies, that's considered kind of gross. Because, you know, have you guys been in a central supply room?
Mhm.
They come in, they stock it, they drop it on the floor, they stick it in the cabinet,
Oh,
you know.
yeah.
I don't know if you've realized, but hospital floors are not that 5-second rule kind of thing, okay? Yeah, they're the filthiest things on the planet, hospital floors. So,